So I'm very excited to introduce our speakers for the last session of the day, an interactive session called Indigenous Evaluation Framework, Storytelling for Community by Community. Facilitating this session are Lanice Baker and Benita McCain from the Urban Indian Health Institute, also known as UIHI. Lanice Baker is from Turtle Mountain Band of Chippewa and is a public health associate officer at UIHI. Benita McCain, who is Koya Khan Athabaskan, serves as evaluator 2 at UIHI. So please welcome Lanice and Benita.
So as Stephen mentioned, my name is Lanice Baker. I am Anishinaabe. And so I am a citizen of the Turtle Mountain Band of Chippewa, which is a federally recognized reservation out in North Dakota. I was also raised at the Fond du Lac Reservation in northern Minnesota, just about 20 miles away from Lake Superior. So I was born and raised Midwest girl. I recently relocated to Seattle, Washington, where I serve as the Associate Officer of Public Health at the Seattle Indian Health Board. First and foremost, I am a mother. I am a self-described public health nerd. I have been working with tribes and urban Native communities for the better part of 20 years, just on a whole variety of public health topics. I always say that I came to this work when I was about the same age as my daughter. I was about 5 years old when I knew that I wanted to make a difference in the health of Native people. And I was really inspired by my grandmother. And so when I come into these spaces, I'm always like positioning myself and telling you who I am because I bring all of those people with me into this space today. And so we're going to be talking about the Indigenous Evaluation Framework at the Urban Indian Health Institute. I want to give my co-presenter just a moment to introduce herself as well, because at the top of our agenda is situating ourselves or positioning ourselves. So you understand the perspective that we bring to our work and the projects that we're describing to you today.
Thank you. Hello, I'm Benita McCarn. I am Koyakan Athabaskan. I was born in Fairbanks, Alaska, and I'm now a guest on Coast Salish land in Seattle. I moved to Seattle about a year and a half ago from Chicago, and I've been working in the public health space for a very long time, for almost 20 years as well. And but most of my teaching was Western teaching and have been working in the Western space. So a year and a half ago, I came to Seattle. I wanted my work to impact the people who are my family, my relatives. I was working a lot in diabetes as my aunt was dying from diabetes. And so I really wanted my work to have impact on my own family and my own relatives. So I come here with my family behind me and my generations before me.
Thank you. You can go on to the next slide, please. I'm controlling the slides. So as I mentioned, we really want to situate ourselves. So our agenda for today is we're going to tell you a little bit about the organization that we come from. We want to outline the Urban Indian Health Institute's evaluation framework. We want to actually get into the space where we're sharing examples of how we've applied UIHI's Indigenous Evaluation Framework in practice. And we want to discuss how you can apply the Indigenous Evaluation Framework in your community or areas of practice. This is going to be an interactive discussion. We actually have t-shirts to incentivize participation. So UIHI actually developed a new campaign that we haven't launched yet. It's called our Data Defender t-shirt. And so we worked with Andrew Morrison, an amazing Native artist out of Seattle, who does just the most beautiful graffiti art. We called him in and we said, hey, we have this idea, this vision, and can you make it come to life for us? And so Benita's going to grab the shirt, but we have shirts available. And so we want you all to join us in conversation, and we're going to bribe you with t-shirts on a yet to be released campaign. And so before we get started, I want to tell you that we're coming here today from Seattle Indian Health Board. And so Seattle Indian Health Board is a community-based, federally qualified health center located in Seattle, Washington. Seattle Indian Health Board is one of 41 urban Indian organizations that were founded to serve the healthcare needs of urban located American Indian Alaska Native people. We have existed at Seattle Indian Health Board for over 50 years. On the orientation, the one thing that really hit my heart about the story of Seattle Indian Health Board, it was that the Seattle Indian Health Board really grew out of the love and labor of Native women. And it grew out of the social justice movements of the 1960s and 1970s. And it grew from women sitting around dining room tables, having conversations, and seeing unmet needs of their community members. And so that is who we are. We specialize in culturally attuned care for Native people, but we say that we serve all people in a Native way. We just got new data. We actually serve nearly 6,000 unique relatives annually. And so we basically call all of the people we serve relatives because that's a cultural way. We recognize the relationship that we have with people who walk through our doors. Today, we currently operate 4 clinical sites, and we're in the process of opening up a 5th location that will be focusing on inpatient treatment to address the opiate misuse crisis that's happening in this nation. The thing that makes that new facility unique and amazing is that 15 beds are reserved for pregnant and birthing American Indian people, and they can bring up to 2 of their children with them when they come to seek help with us. This is our conceptual framework. This is our model of care. And so this is called our Indigenous Knowledge Informed System of Care. Internally, we call it Indigino. And so I'm putting this up here, and the takeaway that I want you to know is that at Seattle Indian Health Board, we put traditional Indian medicine at the heart center of everything that we do. And so we basically have 4 priority areas of service. We do direct health and human services for the relatives, the 6,000 relatives that I mentioned. We have a workforce development program that houses 30 programs to really build up, I think, that next generation of leadership for Indian health. We have a public affairs director who oversees a policy division, and we have a small team of people that are very, very active in advocacy. And the work that I co-lead with our director, Abigail Echohawk, is called the Urban Indian Health Institute. And so that's the 4th part of the work that we do. And so the Urban Indian Health Institute is going to be 25 years old in July. So we were founded in July of 2000. And so we basically exist to serve the public health data, research, evaluation needs of urban dwelling American Indian Alaska Native people. Urban Indian Health Institute is one of 12 tribal epidemiology centers. I know I have some tech partners in the room. UIHI is the only tech that serves the needs of urban American Indian Alaska Native people. And so today we serve a network of 92 organizations that are located across the United States. Our network spans 29 states and 164 counties. We offer this map as a visual to show you our footprint. All of the blue dots represent community partners. One of the most beautiful, I think, aspects of the work that we do at Urban Indian Health Institute is that we really recognize research and evaluation as Indigenous values. And so internally, we frequently have conversations about fundamental truths in our work. And so some of those fundamental truths have been shared by some of the co-presenters here today. We acknowledge that Indigenous people have been researchers and evaluators since time immemorial. we acknowledge that we have always collected and documented data. We know that we have always done that because the survival of our communities, the survival of Native people depended on that. And so that is a fundamental truth that we carry in the work that we do. And so for me, like when I was trying to contextualize this, I was thinking like, how are my people data collectors, right? So my people are Anishinaabe people. Like in our creation story, we talk about migration. Like we talk about the way our people moved basically. And in our creation story, we moved until we arrived to the place where food grows on water. And so wild rice for my people is tied to our existence as Indigenous people. And so I know that like, in order for us to be able to tell those stories, we documented that. That's how people still can recollect. That's how they can still remember. And so that is science, to know migration patterns, to document it, to be able to visualize it, to be able to quantify resources like wild rice where food grows on water, to be able to know like seeds for like our, not just our survival, but our ability to thrive. And so where I come from, that is a part of like Indigenous science. That is a way that we have always known as Indigenous people. And so for the first part of this activity, what are examples from your own communities, from your tradition? What are examples of how your people have been Indigenous researchers and evaluators since time immemorial?
We use counting cords for tracking weather events and changes in animal patterns, things like that.
Anybody else? Weather patterns, tracking.
I would also say something that we're doing today, which I'm really excited about, is that our people have really been, those kind of what you would say, keeping track of our lands and our plants and our medicines. We've always done that, and especially in areas like where I live in Northern California, when you're talking about fire, that is something we have always been the cultural, burning practices, taking care of those things, but also maintaining those land, that seed knowledge. And that's something that our tech crews are now starting to bring back, that seed knowledge. But we've always maintained that over time and through our stories and pass that down. So, yeah.
Yes, absolutely. Another example?
Using the star constellations to know when to plant or when to migrate to certain areas for safety or for food security.
Yeah, with our tribal community, I would think we like spot fishing and always being aware of when spot season to run is a good way we track, I guess, with weather and, emphasis on hunting. Yeah.
Any other examples? At the back table?
Our people, well, like many other Plains tribes, buffalo are important to us. And so even we have like a deep understanding of how the buffalo mirrors a lot of like our cultural belief systems, and also the way in which reintroducing the buffalo to we have genetically pure buffalo in our lands, and it's like improved the cultivation of our traditional medicines, because the biodiversity is like the right, it helps our soil bring back like our sage, and so a lot of our medicines have come back tenfold since reintroducing buffalo and removing cattle from that area. So
And
Thank you.
I'll add one more over here.
Okay.
I'm Choctaw from Oklahoma Nation. And one of the things that my grandparents have taught me is about watching the animals to see what's going on with them. So to see when they're impacted by whether it's environment or other people or other predators, but also to watch their behavior as a way of understanding where you are in your space.
Yes, absolutely. All of those. Are there any more? So I think that those all perfectly demonstrate why we hold like Indigenous evaluation, research, and data as Indigenous value within our communities. Because the way that we documented, the way that we recorded, we ultimately did that because of our love for our people. Like when we're talking about historically, even to modern day, we've documented and we've recorded and we've quantified numerically and in oral tradition and story because of the love of our people to ensure that we survive. And then in modern context, to ensure that we thrive. And so the second fundamental truth that we have in our work at the Urban Indian Health Institute is that Indigenous evaluation and research, those are Indigenous values. And because of the culture and the context and the diversity across the country, we believe as our third truth that it's absolutely essential that Native people participate in Indigenous research and evaluation. It's absolutely essential that we tell our own stories. And it's essential because of that context, like that unique context that each community can have. And so we believe, finally, that American Indian communities can use evaluation as a tool to tell our stories, to highlight our own knowledge and resiliency, and to build capacity to take ownership of the research and evaluation process within our communities. And so at UIHI, we developed an Indigenous evaluation framework specific to urban American Indian and Alaska Native communities. And so this work started 7 years ago. And so it was an effort that was initiated in 2018. And so we published a paper on this in 2023. And so we wanted to, one, point to the resource because it gives a much more in-depth discussion about the process that was used to develop our Indigenous evaluation framework. And it's also an acknowledgement of all of the people that came before us in the effort to basically document and demonstrate our Indigenous evaluation framework. Benita also reminded me that this is an open access publication, and so it's available for people online and it's free to access for people to read. And so within the Indigenous Evaluation Framework paper, there's this beautiful image that basically utilizes art. And so one thing that Abigail and I have been talking about for the better part of 15 years is that art changes everything in public health. Like our artists are storytellers. And when we engage them, they demonstrate and they depict like public health work and concepts in ways that like I can't even imagine sometimes. And so this image basically depicts the core values of our Indigenous evaluation framework. And so in the image, you see 4 women. They have skirts that touch the ground because in the way that we work, we believe that when skirts touch the ground, that's where healing starts because of our connection to the thing that to land, like people have mentioned in the discussion. And so skirts touch the ground, we're connected to the earth. You see in the images of the 4 women that hands are interconnected. And that's to depict the intersectionality of the core values, that they're connected, that they're fluid, that they're related to each other. You see the circular motion around them. You can imagine the way the skirts flow. And that is like essentially to demonstrate that in our framework, evaluation is an iterative process. And so each person, each skirt basically represents our 4 core values. And so our first value acknowledges that community is created wherever Native people are. When Abigail stood up earlier, she mentioned that 70% of American Indian and Alaska Native people reside in urban areas today. And so we recognize that evaluation, it's not like bound by land, it's flexible. It can move, it can be applied regardless of residence, essentially. And so it's not confined to land-based boundaries. So in our framework, we developed a framework for urban American Indian Alaska Native communities specifically to ensure that we're elevating voices of people who live in urban contexts. But we believe that this framework still has utility to any of the communities that you serve as well. And so the core value of community created wherever Native people are, it's a core value in the framework that acknowledges that Indigenous people, we create strong cultural communities wherever we live. And the creation of that community, it basically contributes to a collective development of group priorities, a collective development of strategies for achieving a self-defined collective definition of success. Community creation also helps us figure out what tools are needed and most well suited to collect meaningful data. And so for us in this framework, our Indigenous evaluation starts with the very creation of community. The other core value is the centering of community. And so in our Indigenous evaluation approach, Indigenous evaluation must be rooted in community. It has to integrate a communal process because we believe that evaluation is inherently communal. It's not an individual feat. A community-centered approach reflects the fact, like we had mentioned just a couple of minutes ago, that knowledge is contextual and community participation is essential for ensuring that evaluation is valuable to the people and the community that's participating. And so it's absolutely essential that we center communities so that we accurately reflect the context and that we accurately tell and share the stories and the results from data collection efforts. Being community-centered also means that we recognize the responsibility we have to our respective communities to do evaluation for the best possible programs and service outcomes. The resilience and strengths-based value is the third core value within our Indigenous evaluation framework. And I think some people have touched on this point earlier today. I think within Native communities, when we think about evaluation, when we think about the history of research within communities, there are data dilemmas. And one of the dilemmas is that ongoing deficit narrative that's so pervasive when we talk about the health of Native people. And so that core value acknowledges that in an Indigenous evaluation framework, we need to challenge and disrupt that discourse. And we challenge that and we disrupt that by looking for the strength, the beauty, the resource, the assets, the cultural approaches within community. And so that resilient and strengths-based focus, it requires us to reframe questions essentially. The fourth core value is decolonizing data. And so before I got up here, I actually asked Abigail, the director, I was like, how much can I say on this? Do I need a censor? She said, no, absolutely not. Decolonizing data challenges the system that we exist within, right? It challenges colonization. It challenges ongoing harm caused by colonial approaches to research and evaluation. It invites us to actively critique, to challenge, and to make movement and work to address colonial systems, to disrupt power dynamics within, data collection, the way information is interpreted about Native people and communities. And basically, rigorous data must be collected and used with the intent to benefit our people. Like the activities that we take up to collect and analyze and interpret and disseminate information, it has to ensure that American Indian and Alaska Native communities have decision-making power from the beginning. You know, an Indigenous approach to rigorous data collection is in place when data-driven processes are owned by community. It's, you know, a rigorous data process is in place when the possibilities of exploitation are minimized, when people have the power and the option to opt out if they don't want to participate, and when, you know, other people have mentioned Indigenous data sovereignty. A rigorous data collection process is in place when we acknowledge and honor and implement Indigenous data sovereignty. And as other speakers here have mentioned today, Indigenous data sovereignty asserts that our communities have an unchallengeable right to collect, own, and apply data for the benefit of our people. And that right has existed since time immemorial because we have always been researchers and evaluators, collectors of data. So decolonizing data recognizes that data are more than numbers too. It recognizes that stories are data, that art is data, that winter counts are data, that beadwork in communities, it's data. And so all of these forms of data are valid and they're necessary and they're absolutely essential so that we can create that full story, so that we have numbers, so that we have narratives, so that we can sing a full song. So before I hand it over to my co-presenter, our Indigenous Evaluation Framework has been used on 261 projects in the past 7 years. We actually went back and did an inventory recently because we had visitors. We had relatives come and visit us from Alaska. And so we went and we basically did a search. And so we have utilized our Indigenous Evaluation Framework 261 times. And so we've applied this to a variety of health topics. I think that's an important point with the 261. We've applied it to our community grants program, where we have community partners across the nation that are working on chronic disease prevention. We've used this framework in workforce development, where we have interns that are participating in programming, fellows that participate in programming. We have also been invited to utilize our framework with external partners to basically evaluate a host of evaluation topics, a lot of them focused on Indigenous food sovereignty programs. And so I want to turn it over to Benita, where we get into more fun pieces, the interaction. Benita is going to take some time to basically guide us through the tools that we've developed within our framework. She's going to contextualize some of the ways that we've utilized the Indigenous Evaluation Framework. And then we're also going to do an interactive activity so y'all can try to basically get more t-shirts from us.
Thank you. So how do we put this all into practice? I'll share some examples of implementation, as Lenise mentioned, and really have this conversation. It's coming full circle from where we started this morning. So looking at the ways that we integrate all of these, our Indigenous evaluation framework, and essentially evaluation should be telling a story of a program or what is being evaluated. And then we start out with thinking about how our evaluation serves the interests of community. It won't always match what funders want, and that is fine. That we want to take the time to figure out how to collect what the funders and community wants. Our evaluation serves a dual purpose for funders and for community. So maybe funders want to know how much the program increased access to a particular service, but the bigger question for community and the bigger story for community is how the increased access impacted physical, mental, spiritual, or emotional health, and thinking through just what really matters to community, and the starting point is right there for evaluation. I'm thinking about data, and I'm thinking about how we just talked about data is stories. It's about our beadwork. It's about art, so data encompasses so much. It's more than just numbers. There's qualitative data, there's the quantitative data, but it represents our community. It represents our people. It represents our aunties and uncles, and also our children. It's about the story of a program, what is working and why, but we also take the time to look at what can be improved and what can better serve community. We wanted to share this example of qualitative data. This is an example of displaying or disseminating qualitative data. And it's sharing this data back with community and putting that qualitative data in this interactive tool that we had created at UIHI. So each of these points on the map represent a community grantee that we had worked with. And then it has clickable links that when you open it up, it has a description of the programs, description of the communities they serve. It has stories there, but it's just this different way of displaying qualitative data and just being really creative with it. So talk story. Are you familiar with this term, talk story?
No.
Yeah. I'm seeing some nods. All right. So UIHI adapted the talk story method that was described in the Journal of American Indian Education by D.K. Singh and colleagues, in which they had 3 Hawaiian educators on the importance and talked with them about the importance of family, community, and the nature of knowledge. So we customized this for urban American Indian and Native communities. Well, the community grantees in the program that Lenise had just talked about, at the end of the program, we conduct talk stories with them. And it's this great way of building relationships. So we have the program people on the call, and then we have participants on the call as well. And we're not trying to look at critiques of the program. So we want these people together. And what I found that it's such a great way of building relationship, because a lot of the things that the program participants talk about are the ways that a program impacted them. They hadn't mentioned it before. Or these questions, these semi-guided, facilitated questions are things that the program hadn't asked. And so when we ask these questions, they tell us these stories, these magnificent, beautiful, beautiful stories of the impact of the program that they just hadn't had the opportunity to hear before. And so we leave these calls, they're usually on, we have a Zoom meeting and have these calls, and we leave it with just like everybody's smiling, and there's just like such a happy feeling as we leave it. But it's just this way of collecting data and collecting the story of an impact of a program. But it also creates these and fosters the relationships and deepens them really between us and the participants and the program that's implementing the projects. Right. And we also created these community participant surveys for grantees, and they collect this data from participants who attend different community events. We created these surveys and added these culturally attuned images to it. They hadn't been previously available, so the art was developed with Headwater people as it didn't exist before. So the surveys asked about cultural resources, they ask about traditions, they ask about Indigenous identity, they ask about access to and knowledge of healthy and traditional foods. they also build relationships within the urban Indian community. So they ask about the different partnerships that were established, and they share the how participants share the knowledge and skills that they learned through a program with family, friends, and community. It's easily modified. We provide it as a template, but then it's modified, and programs can use it as they need, and also just modify it to fit their program better. And we're still able to compile all this data together. And we have had really high response rates. We recently took a look at the data that was collected between 2018 and 2023 and found that we received 2,035 responses. So this is another example of how we incorporate the core values of decolonizing data. So those core values that Lenny's touched on, of decolonizing data, of collecting it and using it with the intent to benefit Native communities. And we're also cognizant of how we share results. We also share results in this way of creating these culturally attuned imageries. And so people can look at it and just reflects their culture, it reflects things that are familiar and that also are culturally attuned. So I wanted to ask a question, and when we look at this way of presenting data, of presenting like survey results, which of those values are we reflecting in this way of presenting data? So those core values of decolonizing data, of creating community, of resilience and strength-based.
It's positive. So you're reporting on the positive side of it instead of the negative side.
Yeah, so showing that resilience and strength-based approach. Yeah, absolutely. Are there any other core values that you see here represented?
Yes, with decolonizing data, you can tell just even looking at that second data point that it's used and collected and disseminated with the intention of improving Native people's health. Like it's really apparent through the questions, through the images like you shared.
Yeah, thank you.
You're welcome.
Any other ideas or comments?
Yes, I see that. To me, it's really holistic. I love particularly when we're looking at the understanding of health and wellness. And that's really one of your first values, that we're going to be holistic in our approach. Thank you.
Yeah, thank you. Thank you. And I love how we're talking about these different values that it represents. And so a lot of the methodologies that we've created and that we use in our Indigenous evaluation, they're not just reflected in one of the core values. They're all integrated. Like we saw that image where everybody's dancing together, like they're all integrated. And so I think that this really illustrates that of how they interplay off of each other. And this is from submission from one of our community grantees. So this other evaluation method that we use from our community grantees program is a photo narrative. Has anybody used photo narratives in their work? I see you nodding. Do you want to share how you've used that?
We've actually used it really nicely with youth and given them an opportunity to kind of show things, for example, that are impactful for them or things that maybe affect their communities. And so it's really a nice lens because you have the image and then there's also often a story that can go with it that helps you really understand and get to some of the heart of where there are concerns, there are worries, there are also just amazing points of growth that you wouldn't necessarily get in other ways of collecting information.
Absolutely. Thank you for sharing. Are there other examples of using imagery or photo narratives in your work? Yeah, go ahead.
In my volunteer work, I'm from Flint, and we also work with our youth to teach our youth in the Flint Public Health Youth Academy, teaching them different rigorous research methods. And we used a process like this when we had our youth look at their environment in terms of parks and grocery stores in the area to think about what kind of community we want to see in Flint and how that, how the strengths that we have and also the challenges that we have can be improved.
Thank you for sharing that. And this particular one is a photo narrative that demonstrated before and after. The first photo shows purple sage, and the second photo shows jars of purple sage olive oil. So essentially what they're illustrating is this process and outcome data done through photos. And the process is finding the sage, it's going out and harvesting the sage, and then processing it and adding olive oil. And then the outcome is the purple sage olive oil. So this particular project was addressing chronic disease prevention. And not only did the participants learn about a method of preparing and harvesting traditional foods, but they also went out in the community and they picked the sage and they were able to participate in different physical activities. So it had this, all these different layers of chronic disease prevention. And so these are also different ways of showing process data with projects. We also include an evaluation method with grantees that we call change stories. And grantees, we ask them to submit photos. We ask them for 2 photos, and then we ask them for a short description of the photos of the change that occurred as a result of the program. And so this is one from one of the grantees. And when people are really invested in the process, they go above and beyond. So here we asked for 2 photos, we received 3, and this happens like really, really regularly. And so we have these 3 photos, and this particular program, this grantee used the support from UIHI's community grants to continue hosting a support group for Native American cancer survivors and also their caregivers. So the support group meetings sometimes included these interactive activities. So you see this illustrated here where they're in a group exercise class, and they also have group art making. At one point, the support group participants created digital stories about their personal legacy. One of the elders of the group decided to make her digital story about her artwork that she creates, and specifically about the craft of making what she calls God's eyes. And in the change story submission, the grantee described that, quote, at the support group sessions in which the participants shared their digital stories, she gave each member a small God's eye piece that she had created. This story demonstrates how culture through art can bring people together, embody values, and give Native people strength during tough times. And then another photo narrative example from our community grants program. And again, they submitted more than we asked, double than what we asked, 4 photos. And this organization used the grant to support a community gardening program, which focused on traditional foods. The program led to an increase in availability of traditional foods, as well as higher attendance at their events. The change story highlights how these community members were excited to get their hands in the just on the traditional foods. It also shows how there is community interest in learning about and community's desire for more culturally based health programming. One community member was a trained chef in classic French cooking and commented that through these family cooking events, she was able to increase the availability of traditional foods that she uses in her classic cooking. And also it inspired her to blend her Navajo traditions with her culinary training. And also she was able to bring others along with her on the journey, and has this intergenerational learning components as well. And finally, art. We talked already about how art is data. And Lenice had touched on our workforce development program that we have at UIHI, where we have interns. And at the end of the internship, we ask the interns to create an art piece about what they learned while they were at UIHI. So this was an intern whose name was Abaki, and they created a collage. And in the back, or it has different layers. And in one of the layers, it shows her great grandmother processing traditional herbs. And behind it is our code. And in the front, she has the words, "We have always been scientists." And it represents how her work is grounded in traditional knowledge and supplemented with Western practices. All right, so now we're coming to the interactive portion. And so on your tables, you'll see that you have some paper. And this is a time to have rely on the collective wisdom in the group. And so what we'd like to take some time to have us work on as a group is to think of a barrier or a challenge to implementing Indigenous evaluation at your organization. Or another question is, what is a difficult evaluation issue your organization is currently grappling with? And so write that down on your paper. And then, Jeannie, this is where we can pull up. We also have, for those of you who are joining us virtually, we wanted to have a way that you could participate as well. And so what you'll see is a link to something called Pigeonhole. And you can send in your questions there. All right. So there's a second part to this though. So once you've decided on the evaluation question or the data collection method or something that your organization or you are grappling with, then write that on the piece of paper, and then we're going to have time to think of ideas for it. So what we'll do is you'll write this on your piece of paper, and you can either move to the next chair or you can pass your paper to the next chair. And everybody at your table will have an opportunity to comment on your particular evaluation challenge that you're currently grappling with. And so we want to rely on the collective wisdom here on all of the knowledge that's in this room, and get some ideas for how to respond to some of the evaluation things that you're working on in your organizations. What you'll see up here is it's the virtual it's the virtual conversation. So this is for the people who are joining remotely, but for those of us who are in the room, write it on your piece of paper, and then we'll switch and you'll have a chance to comment on the one on your neighbors and provide ideas for them. All right, I hope you've gotten some really good ideas and for managing or for dealing with your evaluation challenges. And for those of you who are joining us virtually, thank you for participating in this. And before we go to share outs, I wanted to make a clarification. When I talked about photo narrative, I wanted to mention that that's not a methodology that we developed at UIHI. It's based on photo voice. And so it's a method that already worked really well, but it's really a Western kind of method. And so what we added to it was this fidelity piece, and where we can look at the pictures and we can make, so we have the qualitative data with the pictures, but we can also quantify things. We can look at the physical activity and quantify the number of physical activity minutes that people participated on. And so we have this mixed method approach. But the other part of that is that it's, there's in those pictures themselves, it was that intergenerational those intergenerational activities are shown to just have such a protective factor. So I just wanted to mention that as well. All right. So I'd love to hear what you discussed and some of the challenges that that you've been facing with your organizations, and then some of the ideas that your peers shared with you. Who wants to start? All right.
Okay, we'll be the guinea pigs. So we talked a lot about, in terms of evaluation challenges, the cost and time versus the data, and oftentimes to do it right, to do storytelling, to really actively and thoughtfully engage community, that takes time, and that there's a cost to that versus just running the numbers and pulling data and submitting that. And so, sometimes that presents its own challenge. We really, we all kind of talked about how stories help describe and define the data. Like, we understand that, but then there's difficulties about where to start with that and whose story and those kinds of things. Some folks gave different examples about, working in a large city like New York, where there's many cultures, many languages. How do you encompass everyone? How is that really representative of the full community? And then it becomes, kind of a turf battle of, well, we can't serve everyone kind of thing. And that then is an excuse to kind of limit that. And then we had a person speaking from a university perspective, and they talked about some of their evaluation challenges is that oftentimes it's very narrowly focused, but the community representation that they're really wanting to serve is much broader than that. And so being able to be more inclusive of everyone and have that representation. And then really when we kind of got down to it, it's kind of a chicken or the egg issue, what is evidence-based? And when you think about evaluation, evidence-based according to who? The evaluator, the funder, the federal grant, or the community itself. And so, we also talked about how there has been somewhat of a shift for folks like SAMHSA or CDC to talk about Indigenous knowledge and Indigenous evaluation. But then when it comes time to actually use that in the purpose of grant reporting, then there's a whole list of reasons why that doesn't count as evidence-based. So like, how do you use Indigenous knowledge and Indigenous evaluation and still meet their standards of, evidence-based? So, you kind of deal with that. Ultimately, we agreed that the stories define the data, and that's what's impactful, so that's what's important. There has been some shift in philanthropy, and so they are starting to understand that it's more than just a check, it's about the impact of change. And so that's kind of helped create some solutions. We also talked about, you really have to think about it as being incremental, over time. So any step forward, any win is a good win on that given day. And that's how we get ultimately to where we're going. And that information gathering can sometimes get lost in what we're looking for in the long run is sustainability. So that's kind of where we're at. Did I leave anything out, you guys? You want to add anything? Okay.
Thank you. All right, do you want to come up and get a t-shirt? We get a group t-shirt. You guys have to fight over it. So back here over on my left, there was a hand up to share out as well. Right.
One of the main things we talk about, I think, as well, is the staffing capacity and trained individuals to do so. And we kind of got into this conversation about workforce development. It was really a conversation on all different levels of incorporating evaluation for immediate needs that we have now, but also how are we working with tribal colleges and universities to provide partnerships for things, even in implementing some of these things, but also in filling positions to train individuals to do this. And then working with youth as well. Not just in getting them interested in the outfield, which is really important, and building those partnerships with, I think Kenzie had shared about working with universities and the Orange Day, but also in partnering with organizations that are already doing some of these things. We kind of came up with this like grow your own kind of idea in that we have the resources available, and knowing where to go and who to work with, and not just relying on, we don't have the staff, we don't have the capacity, we have the ability to make small commitments, prove that with our own organizations. And kind of echoing a little bit in through pushback, focusing on Indigenous evaluation as part of branding processes has gotten better. It's still not perfect yet, but getting out of that mindset. And then the last thing we kind of talked about too is, are we creating our own cycles and when we're writing for these grants, we're putting in these metrics that are in there that aren't Indigenous evaluations. So then we're having to report out on things that way. And so even something that happened when we're writing for grants or developing these proposals, thinking about it at the forefront and how can we do this. And maybe then it means that our grant proposal isn't gone through, but we're reporting on our metrics that are valuable to us.
All right.
All right. So we had a little bit of a discussion. I work in my tribal community, and so I also teach evaluation in the UND PhD program. And so we have these conversations in class even about how time is really a constraint. And so there was a two-part thing. So my colleague here brought up, because I had mentioned how a lot of times I created this evaluation model to implement into our tribal health dental program, but the capacity is one issue, having the staff to support it, but also time. Like time is a currency that we really struggle with, particularly in Indian country, because we're in crisis and reactionary mode all the time. So I had mentioned, even like my therapist brings up, there's glass balls and there's bouncy balls, and you have to determine which is glass and which is bouncy. But sometimes in our communities, everything feels like a glass ball, and it's hard to prioritize. And then you also have your tribal leadership that reinforces what their priorities are, and everything feels like a glass ball to them as well. So there's that aspect of time constraints, but then there's also, we know that evaluation a lot of time is centered based upon the granting agencies. And so my colleague here brought up how even the sense of urgency from those agencies is kind of centered in white supremacy and really not allowing us to think within timelines that matter to us. So we have this two-part issue where our communities are in constant crisis mode, and how can we pause and do meaningful evaluation work for ourselves? Because I also believe in internal capacity. I believe that evaluation would be more impactful in our tribal communities done internally within us. But then also, how do we counteract that when we're working with evaluators or outside agencies requiring this information on their time constraints, and asserting that? I always talk about Indian time, it's got a negative connotation, but I talk to my class about this, I talk to different people, is that Indian time really is centered around everything happens when it's supposed to happen. There's natural flows in our community, there's natural dynamics, when to do things, when not to do things. And so those are things that we have to contend with, particularly when we're looking at evaluation.
Thank you. How about over on this side of the room? All right, go ahead. Right here.
To build upon that, one of the things we talked about was the lack of recognition for how colonial thinking shows up in research, how we have painful and deep stories to tell that go back hundreds of years, and how the connections fail to get made between the findings and what the potential cause or correlation is with those findings. They pick a lot of times the low-hanging fruit, the easy things to measure, and skip over the really hard reasons why those things are happening. And then another factor is that community-led does not mean just community leadership-led. It means full community led, and how a lot of times it's funding-driven and agency driven as opposed to community driven, because the community might be asking for something like a health impact assessment that they need to, let's say, find a coal mine or something coming into the community. But that's at odds with what the other objectives are for the state that maybe wants to push that through. And so even if the community wants something, it's not necessarily somebody else's priority.
Thank you for sharing that. All right, and one final right there.
All right. Thank you so much for this. This was very eye-opening. One of the things that we talked about is that the state not being culturally competent when providing state surveys. And one of the things that stuck out to me that we talked about was build a coalition or a working group to advocate for more culturally relevant surveys. And that's just something that you see in Indian country from where I'm from, Montana. And so getting those surveys, which we need to fund those communities, has really been something that's been difficult. There's some other added things that have come from the government, and just making sure that we're getting those voices. And I got a lot of ideas from my table because I don't have a lot of data experience, so all of this is really great to me. But there's a collective at my table that's just there. They have a wealth of knowledge, and I'm very jealous of all of them. They're just amazing. And then you guys are too. And thinking of that, and then we talked about that too, if someone else had like federally funding requirements, and just making sure, because some people just don't know. They just aren't aware of it. And so having culturally competent trainings, or whatever we are calling it now, and then showing that Indigenous evaluation framework and bringing that to someone. Because if you don't know it exists, then you can't use it. And so those are just some of the talking points. And just thank you again. This has been great.
Mm-hmm. Thank you so much. You touched on something that we had really wanted to draw on. There's so much collective wisdom in this room. There's so much knowledge. There's so much experience. So I hope you had the opportunity to have some of those insights and the challenges that you're facing. And I'm going to ask the AV team, can you switch back to our slides? And thank you so much, AV team. You've been doing amazing today, and thank you for your work. All right, and I'm going to turn it over to Lenise, who's going to wrap us up.
Thank you for all of your conversation, I think, and the collective wisdom within the room today. I think it's really important that we acknowledge the challenge and pushing forward, I think, Indigenous evaluation. So before we close, like on that slide, like I want to acknowledge that there are challenges like associated with this. And there are challenges because we're talking about decolonization, essentially. Like that's what my mind is going back to. Like essentially we're pushing up against a system that was designed to erase us. It was designed to destroy Indigenous knowledge systems. And I think like that acknowledgement is absolutely critical in this moment. And so I think like it's one thing to acknowledge, I think, that challenge. But for me, I think it's also about that collective wisdom and understanding that we do have solution within our community. And oftentimes when we look to culture, when we look to like that historic perseverance within our communities, when we look to ancestors that came before us, like I really do like feel like they prepared us to meet this moment. And so while everybody was talking, I think it's about, you know, continuing a collective conversation. It's about acknowledging that. It's about not even, I think, just looking at the collective wisdom within the room, but some of the solutions that were put forward, like on how we document that, how we find resource, and how we turn our attention to solution. There's a group in Canada, and while you all were talking, it came to mind because I learned this in the UND Indigenous Health Program. Dr. Warren actually had put that forward when he was talking this concept of wise practices. And so Jess had mentioned, according to whose evidence. And so I think for us, like an absolutely critical step is acknowledging that our evidence is valid and the evidence that we generate from wisdom is like essential to building forward health. And so there's this body of work that's emerging out of Canada called Wise Practices. And so it attempts to move beyond conversation about evidence-based practice, promising practice, and it inherently looks at the wisdom that we possess, like as Indigenous people and within our communities. And so I want to put that forward as a resource for people to look at. And I think it's a perfect demonstration of Indigenous approach to research and evaluation. There's an example online where communities are talking about suicide prevention, but they completely flip the script. And so there's intentionality about the way that we talk about the issue of suicide prevention. And they're talking about life promotion. And so essentially they go to communities and they ask about that wisdom that's inherent within community, and they're documenting the wisdom, and they call it wise practices. And so essentially, like in Western practice, we call it case studies essentially. In Native communities, it's storytelling. And so I think for us, like at this juncture, what we're essentially doing is we're balancing, right? And I don't believe that it's one way or the other. I think that at this juncture, it's about taking every tool and resource that's available to us to ensure that our people are healthy, to ensure that like my children are raised in a good way, to ensure that, you know, that the future generations that come, that they have like the opportunity to survive and live and to thrive like in the best way possible. And so I thank all of you for joining these conversations, for talking about challenge, and more importantly, for putting forward solutions like on the interactive activity. At UIHI, we have existed for almost 25 years, and we exist in service to Native people, communities, organizations. I'm getting a 2-minute a 2-minute warning. But a part of our work is to really develop public health resources to assist with public health infrastructure projects. Indigenous evaluation is a core of that work that we do. We also respond to data requests and technical assistance requests. If we have resources that are available and that are helpful to you, or if we can assist with, I think, like cultivating resources that you need, we have a team of people that are ready to assist. And so you can get in touch with our team by emailing info@uihi.org. And so get in touch with us. Let us know if you need any of the resources that we've developed. Because if we can help, that's what we're here to do. And so we feel like immense like responsibility and accountability to continue to support, I think, people who are working for the health of our communities. I think that's the last minute that I have, so I'll stop there. We will take questions after.